record on this computer. All right, so this is preparing. And let's see. Okay. All right. So it should be starting. So I've started recording the session. And okay. So it should be live right now. So good morning, good afternoon, good evening. And I would like to take this opportunity to welcome our speaker for today. Before that, my name is I'm Dr. Akwi Asambang, interventional gastroenterologist, and I am the co-founder and board president of the Pan-African Organization for Health Education and Research. Very excited to be here today. We have a fantastic session planned. Today's session, for those who are watching this on Facebook or those who are in the Zoom itself, this will be a private closed session. And so if you haven't registered, you can still register. I am going to introduce our speaker. And before I do that, again, the format is we'll have the presentation by Professor Moise. And after the presentation by Professor Moise, we'll go into our private mode, which would be for the Poher scholars. Our two scholars presenting today would be Derek Musole, who is a medical student at Copperbelt University in Zambia, and he is going to present his research project on pathology related. And then the other presenter today will be Davy Nkenge, who's a medical student in Cameroon. All right, and to our speaker today, Professor Moise would like to welcome you. Trained as a health geographer, Dr. Moise's overarching program of research focuses on families and communities at risk. Her methodologic expertise lies in utilizing quantitative and qualitative methods, often employing mixed method study designs, including geospatial analysis, to examine the social, cultural, and contextual factors associated with health inequities. She's a recipient of the College of Arts and Sciences Scholarly and Creative Recognition Award, the American Evaluation Association Fellowship focusing on cultural responsive evaluation theory and practice, and has been selected for the Fulbright Specialist roster. She currently serves as a member of the Master Public Health Advisory Committee at the University of Illinois, Springfield, the Vector Control Work Group of the National Association of County and City Health Officials, and is an academic editor for PLOS ONE Journal. She has completed work as the principal investigator of the Robert Wood Johnson Foundation New Connections Award, examining age, racial, and gender differences in the causes and context of alcohol-related trauma hospitalizations among adolescents and young adults aged 10 to 24 in Illinois. Her ongoing funded research projects include a National Geographic project titled Land Use, Microclimate, and Water Quality Nexus, Implications for Human Health in the Rokel-Seli River Basin, Sierra Leone. The CDC Southeastern Center of Excellence in Vector-Borne Diseases and CDC project titled A Community-Based Rodent Surveillance Collaborative for Greater Public Health. Her collateral research endeavors include substance use, ecological dimensions of mosquito-borne diseases, health effects of natural disasters, geographic targeting and healthcare access, program evaluation and developing decision support tools. She recently co-edited a book titled Public Health, Disease and Development in Africa, Geographies of Health Series, Routledge 2018. Dr. Moise is committed to geographic and public health research, teaching and practice, and how they inform one another. She engages in scholarship of teaching, learning, research to determine how to best prepare the next generation of geographers environmentalists, and global health professionals. So on behalf of CORHAIR, would like to welcome you, Professor Moise, to our session today. As a friend and colleague, I am absolutely thrilled you could make it today. For those who are watching, it's 8 o'clock in the morning, and I appreciate her being here today. So over to you, Professor Moise. Thank you so much. And I am muting myself.
Thank you, and thank you so much for that introduction. And now that you know me, I think we are small enough here to do a quick round of self-introduction. So it will be helpful if I know who is here. I think I know because Dr. Api told me a little about you guys, but it would be nice to hear from you, your elevator speech. So 1 minute. Let's start with Opelua. Opelua. Yes.
Hello, my name is Opeoluwa Makinde. I'm a final year medical student from Bafemi Awolowo University in Nigeria. It's nice meeting you, Ma.
Oh, thank you. Thank you so much. You were kind of cracking, but thank you. What's your interest in medical? You're a medical student, but do you have a specialty or research project? Oh, she's frozen. Cindy?
I'm interested in public health.
Oh, okay, wonderful. I'm looking at Cindy, and then would be Evis.
Good day, everyone. I'm Cindy Pieterse. I started specializing in family medicine. I'm from South Africa, University of Pretoria.
Wonderful, welcome. And then we Evis, and then Natasha, and then Wangala.
Hi, Prof. I'm Avis Anya Nobith. I'm a South African living in Zambia. I'm in my 6th year of medical school at the Lusaka Apex Medical University, and I'm interested in public health with a special interest in antimicrobial resistance and infectious disease. And I'm also the Pan-African Organization for Health Education and Research Scholar 2021. So really happy to have you and excited to see what you're able to teach me. Thank you very much.
Wonderful, thank you. Hey, Natasha. Oh, you're mute.
Okay. Hi, good morning, Dr. Imelda. Good morning, everybody. My name is Natasha Sichula. I am a cytotechnologist by profession at Northwestern Illinois Hospital. And my long-term career goal is to become a cytopathologist. So I'm really excited to be here. And I'm also a CORHAIR scholar.
Wonderful, thank you. Miriam, and then we have Derek, and then Chani.
Hello, everyone. My name is Miriam. I'm currently a 5th year medical student at the Copperbelt University, and I'm interested in pursuing a career in public health. I'm very happy to be here, and I'm looking forward to this session. Thank you.
Wonderful, thank you. Derek, I think you're up. You keep moving, so I'm losing my my order, but yes.
Okay. Good morning, good afternoon, everyone. Thank you very much for this opportunity. My name is Derek Musole, 5th year medical student at the Copperbelt University in Zambia, and I aspire to be a pathologist. And thank you very much for having you at this session.
Thank you. Thank you for being here. Do we have Nikki? You keep moving. Sith, Kinga, Yusra. Can you please go? Can you hear us? Are you here? Oh, you are mute.
Okay. So, good morning, good afternoon, everyone. I'm Davin Kenge. I'm a final year medical student from the University of Buea in Cameroon. And I'm interested in public health and also have special interest in gastroenterology and hepatology. So it's a pleasure being here with you guys today.
That's wonderful. Thank you. Are we done, Chan?
Good evening, everyone. I'm Sani Gol, starting from South Sudan. Currently studying MBBS in Malaysia, fourth-year medical student. I'm interested in obstetrics and gynae for my future career. And I'm also the 2021 first scholar.
Wonderful. Thank you and welcome. Did I miss anybody? Okay, well, thank you. So this is good. So medical doctors, medical students, and interest in public health. So I'm not a medical doctor. I have a PhD, and then I have an MPH. But thank you for the introduction and the diversity in the interest. I think it's helpful, and hopefully this discussion today is going to be helpful to you. So today I want us to focus, at least in the next few minutes. I'm so sorry, I have a little dog, so if you keep hearing in the background, to really focus on mixed methods. And first, I'll give a short, brief history, and then talk about the characteristics of mixed method research. When do you conduct one? Kind of talk through that. And then why do we use it? And what are the different types of mixed methods? And then go through the steps. So please feel free to stop me if you have a question, or you can type it in the chat as we go. I don't want this to be like a webinar or me talking to you. I'm hoping that it can be more interactive so that you can ask questions. And then if you're working on a research project and you have something you want to know more about, please feel free to ask. So we heard about my introduction. Thank you so much. So broadly, I'm a trained health geographer whose research is interdisciplinary. I focus on basic and applied research, but notably my research is always conducted in cultural responsive ways. So I'm not your typical academic. I don't sit in the office and dream of a research question. I work with communities, or communities come to me with their community problems, and then we try to solve those problems in a cultural responsive ways. That way, my research is translated into practice, and then I get an academic paper, which is what my job requires me to do. But I'm really more passionate about translating research into practice or policy. So my research intersects the disciplines of geography, public health, and vulnerability studies. And it explores the basic questions that are related to fundamental geographic questions, particularly health disparities, equity, access to healthcare, as well as geographic targeting. But I'm also interested in questions that relate to impacts of environmental change, human vulnerability, and human behavior, particularly in predictive models for vector-borne diseases, including HIV. I also use advanced techniques, particularly geospatial tools. I also have a background, my public health is focused on program evaluation. So I can use evidence-based research, but also developing decision support tools to help county health departments and ministries of health to kind of use actionable data to inform decision-making and hopefully to improve population health. Okay. So I really focus my efforts on three interlinked themes. So health behavior, health status, disasters, community environment and health, but also mosquito-borne diseases, particularly in urban areas. And my mosquito-borne disease work in Africa is focused really on East Highlands of East Africa, just trying to see how climate change is influencing mosquito dynamics, where we are seeing in the East Highlands of East Africa, mosquito-borne diseases used to be lowlands, but now because of encroachment, we are finding mosquito diseases more common, particularly malaria, in high elevation areas. So this is the other way in which I think of my research. I think of my research as constituting 4 pillars. And because many health problems are complex and often require interdisciplinary perspective, the broad nature of my research allows me to address such complexity by emphasizing a system, community, or population perspective, as opposed to a disease process, which for the most part, you guys becoming doctors, you'll be focusing on disease focus. So you'll be more disease, but for me, I really focus on population health overall. And by necessity, my methodological expertise lies in utilizing quantitative and qualitative methods, often employing mixed method study designs, including geospatial analysis, to examine the social, cultural, and contextual factors that are associated with health inequities. The goal of my research is to bridge the gap between the production of research findings on health inequity and seeking solutions via problem-grounded research to improve, again, population health, equity, or practice. My target population is really focused on urban residents, maternal and child health population, public health systems, or operations. With that, as you can see, because I'm very interdisciplinary, that means that I use different conceptual frameworks or theories. For example, if I'm doing a research project that's focused on health behavior that could lead to health promotion, I use these different types of theories or frameworks, and sometimes in combination, or I'll borrow from the different existing frameworks and theories and create my own framework. And when dealing with health status, particular context, etc., I use the social determinants of health framework. I've also used a socio-ecological model often, and then I use the intersectionality lens to really kind of interrogate some of the structural barriers that lead to health inequities, particularly among people of color or communities of color. And I have had the privilege through my academic training, but also professional work, to work and live in different places across the globe. I still continue today to work in some of those countries where I have current research projects and collaborations. So this diagram here, as you can see, is just to show you an example of a socio-ecological model that I have used in one of my research projects. Often I include drivers at different levels, which is very important from a geographic point of view. These factors are things in the environment, whether at the individual level or community level, that create opportunities for people to interact and to informally monitor one another's behavior. But they may impact social relationships and provide opportunities for an individual to engage in healthful behaviors or unhealthy or risk behaviors that can lead to a negative health outcome. They may also impact local neighborhood resources that are important for people to thrive, such as income, as well as they may lead to breakdown of pro-social norms, reduce self and collective efficacy for communities to be able to mobilize themselves for action. This diagram here shows you social determinants of health framework that I draw upon in most of my research that relates to mosquito-borne diseases. I also mentor students, both undergraduate and graduate students, and I engage my students, all my students participate in field work, conferences, I co-publish with my students, mostly undergraduate students. I'm also a faculty advisor for different student organizations here, including the African Students Union. So coming back to why we're here, mixed methods. There's so many books, if you are interested in this topic, that you can read or buy and try to read. So many resources out there on this topic. So what I'm going to give you here is just a crash course quickly, but please, you have your whole life to study this topic, but also more importantly, to include the methods and the techniques in your research. It's always important when you're conducting research, at least in my opinion, to not only focus on the quantitative part, that's important, but again, this depends on what you're doing. But it's also important to understand the opinions, the subjective views of those who are affected. But for example, if you're talking about COVID-19, it's important to look at the numbers so we can look at the trends of COVID-19 in the general population. But it's also important to include the voice of those who are affected, the embodied experience of this disease. As you all know, the disease is affecting people in different ways. So having that voice, which is the qualitative part, is important. That way you're combining both the quantitative, which is could be clinical outcomes, but you're also including the voice of those who are affected, so you can have a complete picture, a complete understanding of how you can improve outcomes at practice level, at the hospital or clinic or service delivery point, but also you can understand how you can try to move the needle in improving COVID outcomes for people in different settings. So mixed methods has a long history. As you can see, it dates back to 1959, not too long, but really, since now we are in the 1920s, it seems like a little long, but it's a young concept that was first brought up by psychologists. And then 1973, another book was published that combined qualitative and quantitative data. And then we've had other researchers focusing on data triangulation, but also incorporating qualitative and quantitative data sources. So what is mixed methods? What do you guys think? What is mixed methods? Anybody, quickly? What do you understand by that term, mixed methods? You don't want to talk? If you don't speak, this is what I do in my classes. I will volunteer you to speak. Natasha.
Is this live stream or not?
No, it's not.
Mixed methods. I
There's
feel
no
like
wrong or right answer, so just try. Yeah.
I feel like mixed methods is like, that's a good question, but I feel like mixed methods is putting different ways of research together. Yeah, like finding the different methods of research, and then they could be qualitative or quantitative, and then putting them together.
Yes, absolutely. So mixed methods is a technique or procedure for collecting, analyzing, and mixing, like Natasha rightly pointed out, both quantitative and qualitative methods in a single study or a series of studies to understand a research problem. I think this distinction is very important because sometimes I see people who kind of, because they collect two different techniques, they'll look at, let's say they're using R, right, to analyze data, and then they're using SAS to analyze the different objective for the same paper. And they say, well, I used mixed methods. I used R and I used SAS. Is that mixed methods? Based on this description here? So if I use R to analyze my data, and then I also use SAS, which is a statistical technique, both of these are, to analyze my data, is that mixed methods? Anyone? Miriam?
Yeah. I'm not really sure about that, but I don't think it is. Is it?
Yeah, you're right. So you're right. It's not. Yes, it's not. So mixed methods is when you collect quantitative data and you collect qualitative data and then you analyze it. It's not about using two different techniques. But the purpose of this form of the research is that both qualitative and quantitative research in combination will provide you a better understanding. Like I just explained, you have your clinical outcomes, but you also have the subjective or the views or perceptions of those who are affected by that outcome that you're looking at, whether it's cancer, so you're looking at cancer treatment, or you could look at quality of care as an indicator. You could look at how many people have this type of cancer, where they live, and things like that. And then qualitative data, you can collect questions. You can ask people, for example, on what are your experiences with accessing care? What are your experiences with living with this disease? That way you're getting that subjective embodied experience of how that person is living with that disease or what their views are about that disease. We also define quantitative and qualitative methods in order to understand the mixed methods. And if we have time, now I'll provide you examples from some of my work. So we just defined mixed methods as a combination of quantitative and qualitative. So what is quantitative research? So quantitative research, we do it, we use it so that it can review generalizable information. So when you're using quantitative research, in your cases, you'll be using, for example, clinical outcomes. For those in public health like me, we could use clinical outcomes, hospital data. You could also, and I'll talk a little bit more about this, collect your own survey on particular issue. But the good thing about quantitative data is that then you have your sample, random sample. When you analyze your data, those findings are generalizable to the general population. So it uses measurable data to formulate facts and uncover patterns in research. Whereas on the other hand, qualitative research, like I said again, it provides data about meaning and context regarding the people and the environments or context of your study. And findings are often not generalizable. So quantitative, generalizable, because you're looking at facts. You're looking at what is the total number of people who came in the hospital this year, who had cancer, who had HIV. Versus in qualitative research, you are talking or asking people about their perceptions, their views, their attitudes, their practices about a health outcome. But combined, these findings help us to really get to the core of what is happening. But most importantly, it's important to note that both methods have strengths and weaknesses. But when used together, these methods can be complementary and you can have a more holistic picture to intervene upon or to intervene on. So why do we use mixed methods, or when to use it? You can use it when we have both quantitative and qualitative data. Again, it's not about having the two different techniques. This is about the data, different types of data that you have, whether it's quantitative or qualitative. And you use it when one type of research is not enough to explain or to answer the question. Can you give me an example when you can perceive such a situation occurring, where you think that you need more qualitative data to help you explain what you're seeing with your quantitative data? Miriam, were you about to say something? You're on mute.
No, I wasn't.
Deborah, can you give me an example of where you think you could do something like that? So I'll give you an example. For example, and I'll give you that example a little bit later. We were looking for in Zambia. How many Zambians on this call you know about Insunko? Medical doctors, Insunko. What's Insunko?
Is it that that thing that a lot of elderly people put in their nose? I don't know. Okay.
So yes. So this is common practice, not just in Zambia, in Africa, in most, including here in the United States. It's just that we use different things. So there's these sexual practices. So Insunko is really snuff. People smoke, it's like tobacco. But in Zambia, young girls, they use it to put it down there. This is your own medical doctor, so I can use these words, in their vaginas to tighten their vaginas, because they think that when you have a tight vagina, it's pleasurable to the partner, to your partner. But in essence, actually, it's been exposing young people to HIV. And so when you look at clinical data, you see that there's a lot of young people who have HIV. So you start asking why. What are some of those contributing factors? And in talking to people informally, people say, oh, young people put Insunko, they put this thing down there to tighten their vaginas, and this could be contributing. And so how do you find out about that information to see really if it has meaning or if it's really contributing to the issues or to the current high HIV prevalence among young people? You go and you talk to the young people. You ask them about their attitudes, practices, and behavior towards Insunko, and to see, you assess their knowledge if they know the association of Insunko and health, and that the practice tightening, that's the right term for it, using this product, that it increases their risk for HIV transmission. So that's one example. But it's also when you want to generalize findings to a larger population. Again, qualitative data does not help you to do that, but when you combine the two, you can now generalize. And then you also want to provide an alternative perspective, like I said here, about this Insunko, this product that young people are more likely to use in Zambia to tighten for sexual pleasure. At least they perceive, their partners believe that. But it's also to explain, to explore a phenomena. You may not, maybe you are not sure what's causing something, so you add this voice so you can try to understand that. In research, sometimes, I will show you an example later, you use mixed methods to develop and test a new instrument. So you can write, for example, an NIH R21, which is a developmental study. I'll give you an example of how I've used that, where you use qualitative study design to kind of understand something, and then you use quantitative data like a clinical trial to collect clinical outcomes to inform what you're doing. To overcome weaknesses, to address a question at different levels. It could be at the community level, at the individual level, or combined. And sometimes it's toward maybe you have a theoretical perspective that you want to get to. It could be based on that. And so here's an example, for example. So for example, this is in 2014, the Illinois Department of Children and Family Services, they were seeing a lot of FSD, so fetal alcohol spectrum syndrome in children. So they looked at clinical data, they saw that a lot of kids who were being born were having symptoms or were diagnosed with fetal alcohol spectrum syndrome. And as you know, that's caused with alcohol, pregnant women drinking during pregnancy. So what they tried to do was to try to intervene. And then, but before they intervened, they wanted to see if this will be acceptable, the intervention will be acceptable by by women. And how do you intervene? They realized they cannot just go intervene in the general population, but they can try to intervene on women who are receiving public services, because those are women who are more at risk, but also because if a child was born with FSD, the state was responsible for paying for that child, because most likely the women didn't have insurance and the state. That's why they're on this program. So we pilot tested brief alcohol intervention for pregnant women who were receiving women, infants, and children's services. We started piloting this at 2 Illinois County Health Departments. And just a little background. So despite the availability of clinical tools and evidence-based screening and recommendations, there's little discussion regarding screening, particularly for prenatal alcohol exposure. So we know there's a lot of screening, but mostly it's done by psychologists or psychiatrists for mental health, but not really among pregnant women. Let's see here. Yes, so this is not for Zambia specific, but I'll give you an example for Zambia because I'm doing this in Zambia as well. But this study aimed to evaluate and validate, so you can see evaluate, validate, through surveys and focus group, obstacles and challenges that shape effective implementation of brief alcohol intervention. So again, you could see we're doing this study because we've seen from clinical data that this is the issue. So now we want to go talk to the women so we can evaluate and validate through surveys. When I say survey, is that qualitative or quantitative? Any thoughts on that? Cindy?
Quantitative?
Yes.
No. Yeah.
Quantitative, yeah, you're right, yep, quantitative. And what about when I say focus groups? Kenge? Did I say that right, Dave? When I say focus groups, is that quantitative or qualitative?
Focus groups, I think it's quantitative.
Subjective. When you're talking about focus groups, you're talking to people, right?
Okay, yes.
So it's what?
Qualitative, yeah.
Yes, thank you. And so we did both. So again, you can see mixed methods there, right? We're using surveys, which helps us collect quantitative data. And then we're using focus groups, which helps us collect qualitative data. So we're combining those together. So that makes this study a what?
And mixed method. Oh.
Yes, Natasha. Yeah, mixed methods research design. Yes, thank you. Yep. Yeah, so perceptions. So yes, so mixed methods researcher. So it will be you one day soon. You will be collecting both quantitative and qualitative data, and then you mix the data, you analyze the data. Most importantly, you're looking at these equally, not unequally. So you're kind of weighting them the same way. So the different types of research designs, we just kind of talked about that. So if you're using mixed methods, you're looking at experimental designs for medical doctors, it's usually like a clinical trial, non-experimental designs, like a survey, and then qualitative research methods. We use focus groups. We just talked about those. You can do interviews, narratives. Narratives are really important. Some of my work involves this a lot. And I kind of attach geography to that, and I call that geo-narratives. One of the studies I'm looking here in Miami-Dade County, I'm working with low-income women trying to understand how they make decisions of what they feed their children. So I've given women to make, for example, field notes, so they write when they wake up from the morning. I wake up my kid, I put my kid in the car, and then we drive, and then I pick up my child at this time, and then I stop here, I stop at this McDonald's, and then we take a picture of the McDonald's, and then they attach the narrative. I stopped at this McDonald's because it's on my way home, or because it's cheaper, I didn't have money to buy food. So you're kind of tying the narratives to place, to kind of understand the routine, that kind of the daily routines that contribute to the decisions that women make as it regards the choices they make to feed their kids, and how that contributes to childhood obesity. You can use phenology, mostly philosophical, ethnographies, mostly people in sociology, philosophers, they have those techniques where they go and live in a community for a year. They don't talk to people. They're just observing what's happening and then documenting that. Grounded theory, I use this a lot, where you're doing a research without a theory. You don't go in with a theory, but you go in the community, you're talking to people, and then as you're talking to people, you're kind of formulating the theory that could be that can help you or help focus the study in terms of what is the theory that's contributing to this perception. So what is the theory that's contributing to this, what I'm seeing here? One of my PhD students is using grounded theory right now, looking at wildlife conservation conflict and livelihoods in South Luangwa National Park. And then case studies where you can draw from different places. Quantitative research methods, of course, we talked about that. Is sequential, concurrent, using surveys or using program data and things like that. So this is another way to use it. I'm a geographer, so I like diagrams. So you have the purpose of your study or the objectives of your study. And then on the other hand, you have research questions. And then you have to come up with a research plan. But as you are developing your study, if it's a mixed methods, we talked about weighting or looking at both quantitative and qualitative the same way. So at every stage, if you're thinking about our approaches, you think about what is the approach I'm going to use for the qualitative piece, but also what are the approaches I'm going to use for the quantitative piece. It's the same thing about data collection. You all have to come up with a plan for how you're going to collect qualitative data as well as quantitative data. Same thing for analyzing, same things for sampling. How am I going to sample? If you're using quantitative data, there's different sampling techniques. If you're using qualitative data, usually it's subjective, but you could also decide on how you're going to sample your population, whether it's random or convenience or stratified. So what do we mean by implementation? Here, implementation means that either that the researcher collects both the quantitative and qualitative data in phases sequentially, or that they gather it at the same time, right, concurrently. When the data are collected in phases, either the quantitative or qualitative data can come first. So either can come first. So you can say, okay, I'm going to collect qualitative data first, or I'm going to collect quantitative data. Sometimes, for example, if I'm doing a study, focus groups, I always have a short survey at the beginning where I'm collecting demographic characteristics of my focus group participants. So I'll do that at the beginning. So the first 10 minutes, we do the short survey, and then after that, we do the focus group. So it really depends on you, the setting that you're in, how you decide the best way to do that. A second factor that goes into the choice of a strategy is whether great priority or weight is given to quantitative data and analysis. What does that mean? So the priority might be equal, or it might be skewed towards either qualitative or quantitative data. A priority for one type of data or the other depends on the interests. Of course, it depends on your interests, but most importantly also the audience as well as the purpose of your study. In practical terms, priority occurs in mixed method study through strategies that you use, whether you're using qualitative or quantitative. And you always emphasize either or, again, depending on the objectives. And then integration, again, the types of data that you're collecting and how you're combining them, interpreting them, analyzing that data, and how you're placing the meaning of that data as you're mixing it. And then a final factor to consider is whether a larger theoretical perspective guides the entire study design. This perspective may be one from the social sciences or from the medical. It could be also from advocacy or participatory lens. For example, maybe you using a theory from gender perspective or racial class, again, depending on what you're using. I did a study in New Orleans. I was looking at wider social disorganization and how that was contributing to blight, because there's a lot of property abandonment in New Orleans. And when I was trying to figure out what theory will help me understand the phenomenon that was happening, I went through a lot of theories, and then I stumbled on the broken windows theory, which was really helpful to help me understand that. So what is the broken windows theory? Just Google that if you're on a computer. But the broken windows theory assesses that wider social neighborhood disorganization can serve as cues for other people to not care. So for example, if there's a broken window on one house and it's not fixed, somebody else may break another window on the next house or on the same house, and then that creates wider social disorganization. And the key is, if there's a bad thing in your community, you need to nip it, you need to fix it, because if you don't fix it, it may lead to wider social disorganization. The policing in the US uses that theory a lot. So there's one criminal, you arrest them, you punish them to send a message. So that's from the broken windows theory. Let's see here. And so, again, this is in summary. When you're thinking about what strategy do I choose, you have to ask this question: what is the implementation sequence of the qualitative or quantitative data? What is the priority you're going to give to either quantitative or qualitative data collection and analysis? This is the whole cycle from inception to the end. And at what stage in the research project will the quantitative data versus qualitative data be integrated, right? Because at one point you have to interpret your findings, and you have to start combining or help interpret the data so that it's meaningful. And again, I always encourage people to diagram things. It's very helpful to diagram things so you can see how things will flow and how they will connect. But most importantly, if you're writing grants, the grants people love to see that, because you can write 15 pages and I may not understand it. But if you summarize whatever you wrote in the 15 pages in a diagram, it will be easy for a reader, your reader, to look at that and try to make sense, but also to see how things are connecting and how they are leading to your intended end goal or outcome. So in other words, you have your quantitative data, you have your analyze, and then you have your findings, and then you have qualitative data, the analysis, findings, and then you compare it. What did we find out here? What did we find out here? And then the findings, they're kind of intertwined when you're presenting them, whether it's in a paper or it's at a conference. So just to give you a dive in a little bit on one of these proposals we have here pending, where we are looking at mobile phone platform, proposing a mobile phone platform as a novel innovation for brief alcohol intervention in Zambia. So this study stemmed from 2 summers ago. I went to Zambia with a couple of my students, and I worked with my colleagues at the University of Zambia. Because if you look in the news, there's a lot of reports that Zambian women are drinking, particularly pregnant women are drinking. And so again, so it comes from people are saying this and we're seeing it in the, so it's like, is this really true? And so I went in at Kalingalinga and Mtendere Clinic for 12 days. We talked to different women there. We had a survey, developed a survey, assessed their alcohol drinking, both before they knew they were pregnant, when they were pregnant, how much did they drink. But as you know, there's no legal limit to drinking. Alcohol drinking during pregnancy period is wrong. You're not supposed to drink. But we found that actually women were drinking a lot in Zambia at these 2 clinics. And so based on that, so now we came back and wrote this proposal to see if we can now go and study a little bit more, because that was a pilot study. The first aim, as you can see, is to adapt a step to a healthier baby brief intervention, which is one that I've used here in the United States, but I cannot assume that because it works in the United States, that it will work in Zambia. So the first step is to try to adapt this to a culturally grounded, multilingual, brief alcohol intervention for young people aged 16 to 24 in Zambia. And then M2 is once we adapt this, so when you see this objective and thinking about what we just talked about, what do you think the design will be? Will it be qualitative or quantitative? Safe? So this is very helpful because when you write things, you can also now start thinking like, okay, this is going to be my qualitative design or qualitative research design. So this one, adapt this intervention. What do you think?
So the question, okay, so the
study design, do you think it will be qualitative or quantitative?
It looks to me like, so if we kind of, I think, break down the elements, the adaptation is, I can say, I think not quantitative because it's building something, not measuring something for aim 1A. For aim 1B, I don't know if that's qualitative either. It's almost more design.
Right.
Similarly, for aim 1B, it will need to be informed by qualitative design. But again, it's more about building something.
Yeah.
And then oh, sorry, yes.
No, I just wanted to hear for the first one. So yeah, you're right. So we are adapting, and how do you adapt? Just that word makes you think, oh, it's with young people. So we have to go to these people to talk to them to see if this is acceptable or not, and how can we change it? So yes, so it's qualitative.
Yeah.
So the first part here is qualitative study. We're going to use focus groups, interviews, and things like that. M2 is more design. So this is where you're designing, but you're also designing with these people because you're getting feedback. So it's going back and forth, right?
Right.
And then yeah.
Oh, sorry. And then so for aim 2A, I would expect that this would involve depending on the scale of the study, a mixture of qualitative and quantitative is how I would try to assess the effectiveness. One would be to ideally have objective measures that can be quantified, but the other would ideally to do some, focused interviews that can help appreciate how people are actually understanding their interactions and how they're actually using the platform.
Absolutely.
And then aim 2 is is a project more so than a measurement.
Right. Yes, thank you so much. Absolutely. So you can see the mixed methods kind of being embedded together. It's happening at the same time. You're talking to people, and then you're collecting data, and then you are implementing the clinical study, and then you're getting also the program outcomes. So yes, let's see, we don't need that. And then this was the theory. Always we're writing a proposal. It also has to be informed, like I talked about earlier, either a framework or a theory. And for this study, we're using this positive community norms approach. But most importantly, I mentioned earlier the importance of diagrams. So now you could see here how that study is going to be conducted in one picture, one image, excuse me. So you have, for example, it's recruitment. You are going to recruit. Who are you recruiting? Pregnant women. We have key stakeholders, peer counselors who are going to be the interventionists. And then you have the intervention design. Of course, we have a community advisory board that we're going to convene. We're going to serve as experts to help and review all the tools that are going to be developed. Then we're going to have focus group discussion to adapt the brief alcohol intervention workbook that we talked about earlier. And then we're going to have key informant interviews. And then we're going to prepare the clinics on how they're going to implement this. So we're going to train the senior clinic staff, the peer counselor, and the prenatal nurses. So peer counselor is really using youth-friendly corners, which is good in Zambia. So we have peer-to-peer kind of arrangement there in research. And then the phase 3, this is M2, where we're going to go in now and assess the effectiveness of the adapted tools. So the first phase is really adapting the tools and preparing the clinics. And then here we're going in, enrolling the participants. And then again, you can see it's a clinical trial because you have a control arm, and then you have an experimental arm. And then you have the intervention, how it's going to be implemented. And then you have the assessment tools, where you're going to assess the women first prenatal. So when they come in at intake, and then we are going to follow them up at their 3rd trimester, and then 3 months after they have the baby. So this is what we are doing for the control, and this is what we're doing for the experimental group. And this is the platform we're going to develop there. So in summary, again, you have to determine the mixed method study to see if it's feasible, identify a rationale or what you're using or what you're going to do with that. And then the data collection strategy, it's important to develop that. How are you going to collect your data? Like you can see on this diagram I just showed you, the different ways in which we're going to collect the data is over here, but also on the clinical trial, this is how we're going to do it, to collect that data. And then also come up with a way you're going to analyze your data, both quantitative and qualitative data, if you're going to analyze that separately or together, and then you write your paper as one or as a 2-phase study. Again, this is the same diagram we saw earlier, but it's different steps that I just talked about. And I'm happy to share some of these slides with you guys, if that's helpful. So how do you go about conducting that? So you have to have your research question, and then access both qualitative and quantitative data, and then again, do your literature review, look at the background, consider why you're collecting both the data, be explicit, include early research plan in your report, diagram things out, which I highly recommend, then prioritize. Develop quantitative mixed method questions. What types of questions are you going to ask for your qualitative piece? What types of questions are you going to ask for your qualitative research design? And then collect your data, analyze your data. These are just more explicit steps in each one of those that I've already talked about. And then write your report, write your manuscript, present at your conference. And then you can step back and start look. So after you've done your analysis, it's not done. You still have to step back and start looking at what you've done. Did it describe the mixed method? Was it the best approach for this study, or was it going to be better if you just use qualitative or quantitative? Did you incorporate both qualitative and quantitative data collection? Was it explicit enough in terms of combining those two techniques? When I say the techniques is really research design, qualitative or quantitative. And then when you're writing, it has to be clear to the reader that you're using mixed methods. Some strength we talked about already. Can be easy to describe a report, can be useful when unexpected results arise from a prior study. It also helps you to generalize your finding. You can position a research like transformative work. Some weaknesses takes time, right? And sometimes if you don't know what you're doing, it's like, where do I start? How do I end? What do I do? So, but now you know. And I put some resources here that you could look at and read if you're interested in this topic. Any questions? So I'll take questions now.
Thank you. This is really great. Does anyone have any questions for Dr. Moise? And then we'll, it looks like we have, yeah. So any questions from Dr. Okay, Chani has a question. Chani has his hand raised, and I'll mute my mic.
Thank you, Dr. Moise. This has been so insightful. My question is, it's regard to weakness of the post method. So as in the example you just show now, the research you're working on, published in the Zambia. So it shows that the mixed method, as much as it's good to, like a good approach to look at the studies. So it also as much requires an effort, expertise, and also an adequately use of like the two methods. So you mentioned this in the weakness, the discrepancy in analyzing the data when you're comparing the both data or the both results from both the qualitative and qualitative. So what are some of these discrepancies that may arise while comparing the results? And if so, how do you approach it, especially at the integration of the data from the post study?
Right, that's a very good question. Yeah, what I've talked from my experiences. Sometimes when you're developing your study tools, we get excited, as an example, on the particularly on the quantitative. If you're doing like a survey, the tendency is we tend to ask too many questions. You ask so many questions, then when you're starting to analyze your data, you realize some of the questions, maybe the survey was too long and people didn't complete your survey. So the question that you really need were not really answered fully to help you answer your research questions because your survey was too long. So that is one of the issues that I've seen. The other issue is that as you are analyzing the data, that's why it's always important to develop your tools with the communities. You don't just sit there and develop the questions on your own. You may find after you've collected your data that you didn't ask the right questions. So that's also common. So how do you deal with that? But the flip side to that is that, so if you did your survey the first part of your data collection, the good part of mixed methods is that even if some of those questions were missed in the survey or were not complete, if you did the focus groups, hopefully some of those questions came back. So at least you have that data point in a qualitative part of that. And so in that instance, what I do is I always turn those questions into those responses from the qualitative study into quantitative. How do you do that? So if you have 12 people out of 15, if that was your sample for the focus group, who said it's very difficult to go to the clinic. It's very difficult to go to the clinic. So when you're coding, the frequency of very difficult comes up 12 times. Excuse me. You can turn that variable, that indicator, into a quantitative data point where you create a question. Is it easy to get to the hospital or not? Or to access services or not? So it's a yes and no. So then you have your quantitative data derived from your qualitative data collection. So that's one way of addressing that. Does that answer your question?
Yes, it does. Thank you. Thank you so much.
Yeah. And that's one advantage of doing mixed methods. But had you only done the qualitative piece, then you're just stuck with what you have. Any other questions? Or should I ask you? Give you a short quiz. I have it here.
And also, Fiola has a question. And also I'll stop recording this. And then we have a couple of presentations from Davey and Derek with their specific research proposals. So I'm going to stop this presentation right now in terms of the recording. Fiola also has her hand raised. Actually, why doesn't Ophelia ask her question, and then I'll stop the recording and we'll end this recorded session. Go ahead, Ophelia.
Yeah, thank you. Well, my question is, how do we get to analyze qualitative data, considering that there are interviews, subjective views of participants? How do we get to analyze this part of a mixed research?
That's a very good question, and one we didn't really talk about today. So there are techniques of analyzing qualitative data, but the way you analyze qualitative data is really trying to derive themes or concepts that come up from your subjective, from your focus groups, from your interviews, and they are there's software that you can use, Atlas TI, in vivo, too. There's a Judusi is another one that you could use, but really it's called coding. I think that's another session we could have where we have to go in terms of how do you analyze that data. Usually what I do, it's always best practice to have two people code your interviews or focus groups. That way you can calculate what we call an inter-rater reliability, because the way Avis may interpret what they're hearing from the focus groups and how Deborah may hear it may be different. So having two people code your data to derive the common themes that are coming up. So for example, if your survey is about understanding COVID-19, all you do is you're going through the transcripts or the audios. You are focusing on trying to hear what are the common things that are coming up. So if you hear access or issues with access to COVID tests or COVID vaccines, you start coding those, you give it a name, access. So anybody who says, oh, I have trouble going to the clinic to get tests or to get my vaccine, they get flagged as access. If you have somebody saying, oh, I don't have anybody watching my kids, so I can't go get to the clinic, so you could have maybe, I don't know, maybe childcare. So you can name that theme as childcare. So you start flagging things and grouping things based on themes or concepts. And then you can start analyzing that. And that's where sometimes you can turn that into quantitative, how many people said this, but also you can add those quotations. So many people said this in quotations. Let's see here. Let me quickly pull something so I can show you quickly. That's a very good question. Let's see. Trying to share something here. So here we go. So for example, in this study, yeah, so focus group audio recording. So you always have to record. So when you're doing your qualitative data, it's a good idea to record because it will allow you afterwards, after you hold your focus groups, to go back and transcribe, but also it allows you during the focus groups not to be taking notes, but to be listening actively. And then after you have your recordings, you transcribe them. And then after you transcribe, you do the coding, which is what I just talked about, where you can use the software. In this instance, we used in vivo to derive the themes. You're using those using qualitative content analysis, where you're grouping things based on what you're hearing. For example, in this study, the one I talked about, looking at young people's views about intravaginal practices, the Insunko, and its contribution to HIV. So some of the themes that came up, so you can see, so we had themes, knowledge, and rationale for using intravaginal practices. And then we had also just what are people saying about these intravaginal practices? And then what are they saying for strategies for changing in intravaginal practices? So these are the themes you come up with as a researcher. And then you can also break down knowledge, for example, your themes into sub-themes. This is what we did here. So when we talked about knowledge and rationale for IVP, two things were coming up. It was rationale for using intravaginal practices for tightening and cleaning, but also there was views that were coming related to knowledge of health risks associated with that. And then you can start, okay, what is this theme? So when you're writing, so you say this theme describes reasons for using IVP, the level of awareness. So you explain what the theme is and what the sub-themes mean, and then you give examples of what people were saying, right? So because we talked to both men, we also talked to boys. So for example, the boys were saying, cleaning of course has to be there. A woman has to clean her vagina. A woman has to clean her vagina in order to do away with bad smells. And then the girls, I think we would have a bad smell if we are not cleaning. So you could see, depending whether we talk to the boys or to the girls, the views were converging. It was all about cleaning, cleaning, cleaning. It's good for your health. And then, so that's how you report that. So that's for qualitative. And that paper was just qualitative. Good question. Let's see, somebody typed it something here.
All right, thank you so much. As we're looking through that, I'll end this recording now, and then maybe we can actually have a presentation. And looking at the time, we'll start off with Derek. Let me stop recording.